This is Christine Porter with the Times News. I'm here today with Dr. Shawn Mendonca, a urologist with Lehigh Valley Health Network. We are talking about treatment options for avoiding dysfunction in men.
What causes an enlarged prostate?
Known reason for why men have an enlarged prostate. A lot of it has to do with familial history, the genetics that are passed down. Unfortunately, there is nothing you can do to prevent a prostate from getting enlarged. There are behavioral modifications. For example, a man who is unable to empty their bladder, you could ask them to do something called double voiding. You tell them, okay, you go to the bathroom, you pee, wait a minute or two, and then pee again. And then that usually would solve the issue of emptying the bladder. Or sometimes with certain patients, we have them on time voiding. We tell them, okay, you go to the bathroom every 3 hours, no matter what, or every 4 hours during the day, and kind of keep your bladder empty. And of course, if someone's waking up at night many times to pee, the first question I ask them, what are you drinking just before you go to sleep? Are you having a cup of coffee before you go to bed? When's the last time you take fluids prior to going to sleep? So if patients are waking up many times at night, we usually ask them to restrict their fluids 2 hours before bedtime. If they're on something like a water pill or a diuretic in the morning instead of at nighttime. So there are certain behavioral modifications we can counsel patients to modify. Then in addition, the first line of therapy after that, let's say lifestyle changes don't work. We have medications. We have medications to help relax the prostate. That way it'll help patients improve their flow and help them empty their bladder. That's one option. There are also medications to shrink the prostate. And that has found to, usually if someone's terribly symptomatic, we have them start both the medication to relax the prostate and shrink the prostate at the same time, or one or the other. There's an art to how to manage patients and help them get through it. Sometimes patients have a main symptom of urgency where they find themselves running to the bathroom all the time. In that case, there's a medication to help them, there are medications to help them relax the bladder. And so typically we go up a ladder or a pathway from least invasive to maximally invasive to help patients out.
What kinds of side effects are there?
For the first line of treatment for medications, for alpha blockers, they're called, that's usually the medication that relaxes the prostate. The side effects are typically, the same medications also affect your blood vessels sometimes. So some men, especially older, more fragile men, they can experience some lightheadedness, dizziness, those type of side effects, especially when they're moving from resting or sitting position to standing position. Usually the side effects occur, after taking the first few doses, and then eventually over time, men usually don't have any more side effects. But usually in a male who's elderly or is on a lot of blood pressure medications, or in fact, it's a known contraindication with HIV medication. Those are the men I'm more wary of. I'm like, look, the first time you take it, make sure you're around someone, because you may get lightheadedness, dizziness, and the last thing we want is for an elderly person to fall down. Another side effect is for these alpha blockers that people should be wary of is, especially in the population that's sexually active, the way it does is, it relaxes the sphincter and relaxes the prostate. So men who, if they're sexually active and they have intercourse and ejaculate, sometimes what can happen is they still experience the orgasm, but a known side effect is that the ejaculate does not come out of the penis. In fact, it's something called, we call it retrograde ejaculation. The ejaculation goes into the bladder. Doesn't change the orgasm feeling, but it changes which direction the ejaculate goes. And in that instance, the patient would just have to pee it out after. It's not harmful per se, But I mean, the only way it would affect a male is if they're trying to have a child.
Are there any natural supplements, vitamins, that type of thing? I know my husband mentioned to me, he says, ask her about saw palmetto.
Saw palmetto, yeah. So I have patients that swear by saw palmetto, and they are like, this stuff works. When you look at purely from a scientific perspective, there have been randomized control trials that have looked at this. There is no difference in outcomes. That being said, I have patients that swear by it, and I tell the patients, look, if it's not hurting you and if it's helping you, who am I to stop you? I mean, you're willing to pay for the medication that's helping you, I say go for it. You have to be wary about the supplements sometimes, because sometimes they can interfere with some of the other medications you're taking. So that's all I tell the patients to be wary of. I'm like, you can take the supplements, but I would touch base with your primary care physician just to make sure it's not interacting with some of the other medications that may be more important.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.